Now, navigating relationships as kids get into late adolescence, when they hit 15, 16, 17, again, relationships become more complex. The demands of relationships include developing intimacy. Intimacy is very scary for most kids to develop and get involved in, but they're mandatory in order to move on into adulthood. Well, they're mandatory for all kids, and it's difficult for most kids, almost all kids, because of the issues of incontinence when the kids were younger, and because of the issues of genital abnormalities at any time. These issues are going to be more important to the kids with exstrophy than they are to typical kids, by and large. So in this regard, we have to be able to help our kids to understand and help them developing coping skills to be able to discuss some of the very issues that they've been so incredibly private about all of these years of growing up. Because when they have a close friend at some point, some of that closeness is going to involve, or is very likely to involve, situations where they really are going to need to tell one of their friends, hopefully a close friend, will listen. And they don't have to explain much, because the kids, their friends, I don't care how smart they are or how sophisticated they aren't going to know what bladder exstrophy is. They aren't going to understand it. And your child doesn't need to use those terms. All they need to do is say, look, I was born with some strange abnormalities. They've basically all been fixed. But they still worry me because I'm afraid that other kids may find out about these things, and I don't know how they're going to react to that. And if you can help your child to tell their best friend, or maybe their best one or two friends, some aspects of their bladder exstrophy, I wouldn't be very long-winded because the other kids will get bored. But I think that's very helpful. It's going to be very difficult for some kids, difficult for most kids, and mildly difficult even for the easiest going kid. When kids start to reach late adolescence in the 18, 19, the emerging adulthood ages, 19, 20, 21 years old, they're most likely going to they're going to encounter situations where the intimacy is going to have to be really at a greater depth. And before they're going to be able to get very involved, by and large, with in a relationship with the sex of attraction, the person of the sex that they're attracted to, they're going to need to be able to discuss in some ways their own anatomy and their own anatomical anxieties, because it's going to be a block otherwise, a blockade in the developing relationship. So I'm not saying that these kids are going to jump into bed and have sex. What I'm saying is that these kids are going to tend to inhibit their own needs to have relationships with the sex of attraction, because that's what we humans do in typical development, and they're going to be pushed into that typical development by their own brains, not to mention the social and cultural contexts around them. So these are things that they're going to need to be prepared to discuss. Again, not in great detail, but just some basics. Usually those kinds of discussions, what they'll find is that the person that they're talking to is going to be amazed that this child, this emerging adult with exstrophy, can talk about things that are so intimate, because most of us aren't used to that kind of intimacy, especially in males. So if you're talking about someone who's relating to a male with exstrophy, or vice versa, the male with exstrophy is relating to somebody, they're going to be provide an experience that's going to be very unusual, namely talking about things that are very important. So it tends to actually cement relationships and make relationships better. You're always going to find somebody who's freaked out by something that's different, or something that upsets them or makes them anxious or scared, whatever. Those things happen, and kids have to be ready for that too. They have to be ready for that, whether they have exstrophy or whether they're kids in more typical situations, because those are always things that can happen, where you tell somebody something that's important and it freaks them out. Well, if the person freaks out, then you probably need to move on to someone else anyway, whether it be a friend or whether it be someone you're attracted to. So those are the kinds of issues that I think it's very important to understand as parents, and it's very important to understand as a child or an adolescent growing up and developing who has exstrophy, because those are the kinds of issues with friends and peers and people roughly in your own age group that you're going to potentially have to deal with as you develop and move on in life. It's more difficult for some kids, as I've said. It's very difficult for a few, but not very difficult for everyone, just difficult. And for some kids it's less difficult, but it's difficult for everybody, whether they have exstrophy or not. So again, one of the things that you can realize in what I've been talking about is that the children with exstrophy have many of the same kinds of experiential events in their lives that typical kids have that may or may not be at roughly the same ages, but that the kids with exstrophy tend to feel those experiential emotions more intensely. And that intenseness, that intensity, can get in the way of relationships. There's nothing wrong with them having the intense emotions. Those are pretty normal. But what we can do as parents is to help them to realize that despite the intensity, that doesn't need to hold them back in their relationships, whether they're 8 years old with intense emotions, whether they're 12 years old, 18 years, whatever they are. Those are things that we parents can help. And again, if we as parents don't feel, or if any given parent or parents don't feel that they have the ability to do that, they can seek help. And if their urologist can't help them, they can find someone else who can help them in dealing with those situations with their kids. And occasionally I've had a parent who said, I can't deal with these things at all. I want you to talk to my kids about those things. And that's fine. That can be done as well, although I wouldn't want to do that without a parent there. I have had a couple of parents in my career who refused to be there. It was just too anxiety provoking for them. And that's what it was. They were just too anxious. And that's fine. So those are the kinds of things that other people can be helpful with. Sometimes it may be other friends or other parents of other kids who are having their own sets of issues, and we can each learn from the others. So in terms of navigating relationships with friends and peers, I think we've covered a lot of the important parts. Yes, we can't go into every little detail that might occur, and there's no way I could even predict all of the things that could occur. But they're all part of the human experience, so that we can all learn from them and we can learn from others, and getting help through the various support organizations can also be very helpful. Getting help in any way you can be helpful, and we sort of have to put up with whatever shame or guilt issues we have in dealing with these and move on anyway, because these are important issues. So I think that has given you a good basic sense of the kinds of issues that in an overall sense that the kids growing up deal with, and therefore that you as parents may deal with your kids who have exstrophy. And next time we can move on to the relationships that kids have to navigate with adults going through their lives. Thank you very much.